Right, so just to recap the process, if a patient comes in and they need a prescription of Schedule 8 drugs, first, do they need a treatment contract? And if they do they have that treatment contract with them? Can they show you their treatment contract? Now, the second step is you have to check whether this patient is a drug-dependent person and whether they are getting these prescriptions from other prescribers. Then you check whether this patient's regular GP has applied for authority to prescribe in certain circumstances. And that is if the doses are more than what we have specified before. So that is more than 90 milligrams of morphine equivalents or more than 45 milligrams of immediate release morphine equivalents. And there are a few other drugs specified that automatically need authority to prescribe, but you can see that in the prescribing code. And then finally, is there a shared care management plan in place? Now, if you go through all of those 5 steps and everything is in order, then that patient's regular GP has done their due diligence, and I would feel very comfortable continuing those prescriptions if I was locuming. And when I am talking you through that 5-stage approach, I suspect that most situations will not pass even that first stage, where there isn't a treatment contract in place. And to be honest, before I went through all these rules and regulations, I thought a treatment contract in place was a kind of very wishy-washy agreement between the prescriber and the actual patient. But the treatment contract is a document, a standardized document that everyone can access and is completely free. And the way that you would access that, and depending on which state you are working in, is that you would pretty much just Google treatment contract Schedule 8 drugs. And I'm in WA, and the first link that came up here was the actual treatment contract. And I feel that the treatment contract, firstly, is very well written, is a legal and professional requirement to have, and is something that actually engages that patient in that process of prescribing Schedule 8 drugs, or conversely, weaning them off those drugs. I think this is such an important document that I actually want to go through it in this video. And the first part of this document is the patient signing the reason why they are on Schedule 8 drugs. And if their level of functioning is not improving, then it's just not the right medication for them. And you have to take patients off these drugs. The next part of this treatment contract may seem very obvious to a lot of people. So the idea is that you are taking the medication at the dose that you are being prescribed. And secondly, that you will be discussing with your medical practitioner if you want to make any changes to your medication. Now, I've unfortunately often seen that patients will self-regulate and increase those doses. And that is exactly what we don't want to happen with these prescriptions. Now, the second point is something that can commonly happen, and people will come in for what are called early requests of their Schedule 8 drugs or opioid medication or benzos, because their prescription got lost or misplaced or even stolen. Now, with any other medication, we're talking blood pressure medication or statins, that is absolutely fine. Those drugs are not regulated. They are not drugs of dependence. There are no real strict rules around prescribing those drugs. But these drugs are strictly regulated. They are drugs of dependence. And so it is the patient's ultimate responsibility to make sure that these drugs are completely safe. And if that involves purchasing a safe and having a lock in place because of how important these prescriptions are, then that is their responsibility to do that. It is not the doctor's responsibility to fill in lost or stolen or misplaced prescriptions. So you need to be very clear about that. And then again, the treatment contract clearly states that. Point number 4 is the agreement that they will report any side effects, which is obviously very important. And then explaining that sometimes the GP will need to seek authority for that prescription. Finally, point number 6, and we assume this happens anyways, that people are open and honest about their past medical history. This document will clearly state that people have to say that. So if we are in a situation that later down the line, it becomes clear that actually this patient wasn't open and honest with you, well, then the contract ends and the prescription ends. Finally, something that happens quite a lot, and I'm not saying that people are doing this maliciously or not, but let's say you hurt your back and then one of your mates says, here, try some of these drugs. So I do get these drugs from my GP, but yeah, I'm happy to share. Why don't you just try some? It very clearly states, and this is a document from the Department of Health, that doing that is effectively illegal when we're talking about Schedule 8 drugs or drugs of dependence. And point number 10, which is the last point, is the patient is agreeing that the medical practitioner can stop the prescription. And then what happens is the patient signs this document, the doctor signs this document, and it says, please provide a copy of the signed contract to the patient. So if the patient, for whatever reason, needs to see a different doctor, let's say that the single prescriber is off sick or they're on holiday, then they have a treatment contract and they have a document that they can show that practitioner to say that we know what's happening here. We are monitoring these prescriptions, we are doing them with a certain intent, and we potentially have a plan to wean off of these drugs. And finally, this last bit is for the patient's benefit. Why do I need to sign a treatment contract? And let's just be clear here, this is a legal and professional requirement. So if you know that you have patients who are on Schedule 8 drugs and have been on them for more than 30 days, they need to have a treatment contract. So that is a learning point today. Go back to your practice, look at all your patients, see if anyone is on these drugs, and go through the treatment contract process with them. And it may be interesting to see what is the reaction that you get here. And it may actually be an excellent opportunity to talk about these drugs and talk about whether the prescription is actually appropriate for them. Now, the last thing I want to talk about here is the prescribing code actually highlights certain situations that are kind of like warning flag situations. So certain behaviors that the patient is displaying that may make you think twice about whether you feel the prescription is appropriate. And this is here in the Schedule 8 medicines prescribing code under warning flags. Now, some of these are pretty obvious. If your patient is intoxicated or exhibiting withdrawal symptoms, then is perpetuating that prescription actually appropriate for them? If they are refusing to undergo diagnostic assessment, if they are refusing to try other medication options or treatment options that are safer and can be more effective, if they are refusing to sign a treatment contract, that's another red flag, to be honest. Often, unfortunately, patients will be very clear that nothing else works for them. You can list as many options and treatments and drugs as you want, but they will always have some kind of adverse reaction or reason why they can't have that. They need a specific type of opioid medication. That is a little bit of a warning flag. If they're very clearly asking for more and more medication at higher doses, that is a clear indication that their body is habituating. Again, another warning flag. If they are refusing to do drug tests in certain relevant situations, if their function at work or home deteriorates, if they are displaying threatening behavior, and they're showing a complete and utter desperation for this medication, then is this actually the right medication for them? Obviously, if there's forgery involved, there are multiple lost or stolen scripts. And finally, this last bit will come up on your script check WA check, or if you call the prescription shopping hotline. So if patients are getting prescriptions from other prescribers, they have clearly broken the rules of the treatment contract, and you should not perpetuate those prescriptions. All right, guys, that's everything. I know this has been a bit of a journey, but it is really important that if you are prescribing Schedule 8 drugs, you are very clear about the rules, when you can prescribe, when you shouldn't prescribe, and have a clear plan for your patients in terms of continuing those prescriptions or weaning your patients off these drugs. As always, if you have any issues, feel free to leave a comment below and feel free to email me directly. Otherwise, good luck.